Cognitive behavioral therapy underlies really the vast majority of approaches to behavioral therapy for substance use disorders, pain, and even the vast majority of behavioral health disorders. It's a little different than things in the past that have been done back in the days of Freud or that, in that it's meant to be short term, not lifelong. It focuses more on goal-oriented pathways rather than deep dives into the feelings and inner thoughts of how we approach life. It takes a hands-on approach more so than the vast majority of psychotherapies, and it's really brings a practical problem-solving approach to behaviors that patients exhibit and the feelings that drive those behaviors. The goal with this therapy is really to change the patterns of thinking and the behaviors associated with those patterns so that we can get better results when we try to interact with one person or another person. And this has been around for a while, so it's not brand new, it's not a fad. I mean, this is the umbrella therapy for a large number of other therapies, and it was started in the 1960s by Dr. Aaron Beck. And Beck really started this psychotherapy mainly doing psychoanalysis, but realized that patients had a lot of internal dialogue going on before they would have a behavior. And so he started to really explore the patients at this level and realized there was a link between thoughts and behaviors. And while nowadays that may seem like, duh, back then it was kind of a new concept. Beck eventually labeled this version of therapy as cognitive therapy because of its emphasis more on thinking than feeling, which is different than really the origins of psychoanalysis, which focused more on feelings and was also more about coming up with a diagnosis. CBT looks at really the interplay between thoughts, feelings, and behaviors. And the model, really is based on understanding the changing of the meaning we bring to an event rather than changing the event itself. It is evidence-based. I mean, there are hundreds and hundreds of publications on this. There are meta-analyses, Cochrane-level databases. So this is not something that we hope works. We know that it works, and it's been systematically applied to a number of different disease states. And so I would consider this as well vetted as any medication that we write for the disease of, behavioral health or addiction or, any of those. One of the fundamental focus points of cognitive behavioral therapy are what are designed as core beliefs. And these core beliefs are centered around how we view ourselves, how we view others, and how we view the possible future based on our past experiences. And these ultimately shape our thinking, our feelings, and the behaviors that we exhibit to the outside world. So if you look at this diagram, we'll start with this inner part that is the triangle of the core beliefs. And, it has how we see ourselves, how we see others, and how we see the future. And that really is where all of our behaviors start, is that interpretation of those three things. It then starts to move out with the interplay between behavior and thoughts and the emotions or feelings that we have. And as you can see, it's very cyclical. Each thing is dependent on the other. So as we approach a patient in a cognitive behavioral therapeutic fashion, what we're going to find is you can't just pull one of these out and deal with it by itself. You have to deal with the entire matrix. So you have to deal with a person's core beliefs, and you have to deal with the outward projections of those, which are the thoughts and feelings and behaviors. There is an approach to this that is really useful and very simple to use because it is the ABC model. And A stands for the activating event. And this helps us to understand the actual event or the trigger and that person's immediate interpretation of that event that sets up the next piece, which are the beliefs. And the beliefs are a person's evaluation of the event, and whether or not that is rational or irrational, we have to determine. But this is then followed by the consequence of that activating event, followed by the belief, and that consequence ultimately are the behaviors, thoughts, and emotions that we bring to that event. This can be complicated. So let's give you a real world example. Let's think about you're on 6 months of a relationship. Seems to have been going well. You haven't really noticed any bad behaviors or anything. And you come back to the house and all of a sudden you start having an argument over something pretty trivial. And then that argument escalates to where the significant other punches you in the face. That's a significant negative event. The rational belief, if normal, meaning that you have a stable, rational belief that you don't deserve this, that this is inappropriate, you're going to have a healthy negative emotion as the consequence. And that healthy negative emotion is going to be, I am pissed, and I am leaving, and I am not coming back. But if that same person had a different belief system, and it was more irrational, maybe they believed that they deserved to get punched, then what they may have as a consequence would be, you know what, I probably deserve that, and then apologize to the person who attacked them. Those irrational beliefs that we had at that moment of feeling like we deserve that punch are labeled as negative thinking. Now, negative thinking is any type of thinking that leads to negative consequences. And we don't always recognize negative thinking, and in many ways it feels automatic, like it just pops into our head. And that automatic thought that pops into our head is what we anchor to as we move forward. And CBT is designed to change that automatic thinking and recognize those patterns of negative thought process. There are a few different types of negative thinking, and one of those would be the all or nothing thinking. So this is, you know, I have to do things perfectly or otherwise it's a complete failure. So you're either perfect or you're a complete failure. Very black and white. Or someone who maybe just focuses on the negatives, and it could be, you know, nothing goes my way. I feels like, you know, one disappointment after another and a variation of just bad things happen to me all the time. You know, the world is falling apart. I don't like what I see around me. Today I parked in the wrong place and got a ticket, but you failed to pull out the positive thing that you won an award later that day, and you focus on that piece. There's negative self-labeling, which we see in a lot of people, and this is, I'm a failure, this is the Eeyore, right? You know, everything's people who know, if they really knew me, they would hate me because I'm just a terrible person. That's negative self-labeling. And then we also have catastrophizing, and in my experience, this is one that I would see a lot in the emergency department setting as well as in the clinic setting, where if something's gonna happen, it's gonna be the worst possible thing ever. This is, I have a scratch. Oh my God, I'm gonna have tetanus, I'm gonna have tetanus, and then my arm's gonna fall off, and I'm gonna have to cut it off, and then I'm gonna have to like pop on like a fake hook arm, and I'm gonna have to run around, and I don't know what to do. And it's like they just walk down this pathway of the worst possible outcome that could happen. And in that setting, it becomes difficult to figure out how you walk it back. But ultimately, that's what cognitive behavioral therapy is for. And if I give you another example of how that approach and those different versions of negative thinking work, let's talk about Kayla. And if Kayla is walking through the mall, let's just say she's normal day walking through the mall, she sees her friend Melanie, and Melanie kind of looks at her, but doesn't even acknowledge her existence, just kind of walks by. Doesn't wave, doesn't say hi, doesn't give her a nod, doesn't, you know, wave her off, nothing, just basically doesn't even acknowledge her. If Kayla has a negative thinking pathway and she feels bad about herself, then she's thinking, Melanie must be really mad at me about something, and maybe she just doesn't even like me anymore. Oh my God, what's happening? Did I say something? Did I do something? Did I post something on Facebook? And she'll go through this process of all of this negative thinking, and the consequence of that is that later that day, Kayla's gonna start thinking about, oh man, I have a party this weekend with friends, but Melanie's gonna be there. I just shouldn't even go. I just think I'm not going to go because Melanie hates me, and I just can't bear to be in that situation, and I just don't want to do that. So that would be that normal A, B, C. You have an activating event, you have the beliefs that you bring to that, and it's followed by the consequences of that event. What if we flip the frame and we had Kayla's core beliefs set in a rational way and in a much more positive tone? So Kayla's walking through the mall again. Melanie walks by. Doesn't look at her in the eye. I mean, looks at her in the eyes, but doesn't say anything, just walks on by like she could care less about Kayla. But if you have a good set of core beliefs that are founded in positive thinking, then Kayla's going to think, wow, Melanie must be totally lost in her thoughts. Man, I really hope she's okay, because last time I saw her, she was much happier, and boy, I'm worried about her. And the consequence of that thought is going to be that Kayla calls Melanie later in the day. Doesn't even think about not going to the party, doesn't even bring that up. All she's thinking about is, wow, I hope she's okay, and creates that appropriate consequence. And that appropriate emotional and thought and all of those behaviors come together because those core beliefs were set in cement as positive rather than that automatic negative. So if Kayla was to come into the office and have this conversation about, well, she saw Melanie and then she had this negative core belief and then this consequence of not going to the party, and she's starting to spin on these negative thoughts, we would label that as having a thought distortion. And that thought distortion is different than what actual really is. And CBT does help to bring that back, recognize that that is a thought distortion, and start to rotate the core beliefs about self and others and the future by changing that thought distortion to come back to what we would see as rational or normal. Through this process, Kayla can identify these negative thoughts and consequences, really that occur throughout her life as a result of these core belief issues that she has. And if we can rotate those core beliefs, she can start to recognize that having a negative belief creates a negative consequence. Having a positive belief creates a positive consequence. That's really the foundation and the fundamental aspect of that. And in a practical way, this would allow us to use cognitive behavioral therapy on Kayla so that she would decide to go to the party and see Melanie. Even if she had originally had those negative core beliefs and was thinking and spinning on that negative consequence, we could bring her back to realize that's irrational, move to the rational core belief, and then go to the party and interact with Melanie. So you can change it even after the fact, and that's really what cognitive behavioral therapy is built on. The pathway to do that, and I'm going to really consolidate this down to 4 basic steps, and we'll talk a lot more about this as we go through cognitive behavioral therapy in depth with each archetype. But there are 4 steps of intervention that CBT utilizes. So one is you obviously want to identify the critical behaviors or thoughts. So like the one that Kayla had in the mall where she thought that Melanie must not like her anymore and she hated her. You have to find that, which many times requires a conversation and walking back the event so that you can walk through it with the patient. You have to determine whether or not the critical behaviors or thoughts that they have are happening in excess, meaning they're always negative, or maybe it's a deficit of a positive that needs to happen. And so you determine whether or not there's an excess of a bad behavior or a deficit of a positive behavior. And those can be very different. And again, we'll dig in on what that means later. Then you want to evaluate, the behaviors or thoughts. And we want to find out how often they're happening, how long do they last after they originally happened, so that we can get a baseline. Because after we get the baseline and we start therapy and we start working on changing those core beliefs within a patient, we want to start to determine if we need to increase the good behavior or decrease the bad behavior. And we also want to be able to measure it against what it was before so that we know we're doing a good job. And if you look at these 4 things from another aspect, this really is just basic scientific protocol where you identify the problem, you determine the abnormality, you determine the consistency of how often that abnormality happens, and then you intervene on it and determine whether or not the change happened. So at its core, cognitive behavioral therapy is really just scientific method applied to a person's emotions, thoughts, and behaviors, and really focused on their inner core beliefs about how they see themselves, how they view others, and really how they see the future based on those early life things and events that they had happen. It is looking at the interplay between all of these things. We should know that negative thinking really is what creates this physiologic stressed state that we see our patients in, and this can manifest in significant maladaptive behaviors. But the good part is that CBT provides a solid evidence-based framework, for looking at these negative or distorted thoughts, and will allow us to systematically and consistently move our patients through those stages of change, stabilize those core beliefs so that they can start to have positive thinking rather than negative thinking, and help them, quite honestly, with whichever entity we're trying to treat, whether it be depression, anxiety, substance use disorder, or chronic pain. All of those get better with this.